Question 1. The evaluation methodology shows that during a simulated cardiac emergency scenario involving an unresponsive adult patient found by bystanders, an EMT must demonstrate proficiency in immediate patient management. Which of the following approaches best reflects the required competencies for an emergency medical technician in addressing this critical cardiac event? Option A. Prioritize obtaining a comprehensive medical history from the bystanders, including the patient's known conditions and medications, before assessing the patient's vital signs. Option B. Focus on calming the bystanders and reassuring them that help is on the way, delaying any direct patient assessment or intervention until advanced medical personnel arrive. Option C. Immediately initiate high-quality chest compressions and prepare for defibrillation if indicated by the patient's rhythm, while simultaneously gathering brief, relevant information from bystanders about the event. Option D. Administer aspirin and nitroglycerin to the patient based on the bystander's description of chest pain, assuming a cardiac origin, without confirming the patient's pulse or respiratory status. Correct answer is C. Immediately initiate high-quality chest compressions and prepare for defibrillation if indicated by the patient's rhythm, while simultaneously gathering brief, relevant information from bystanders about the event. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of cardiac emergencies, where rapid and accurate assessment and intervention are paramount. The EMT must balance the urgency of the situation with the need for a systematic approach to ensure patient safety and adherence to established protocols. The presence of bystanders adds complexity, requiring effective communication and management of external input. Correct approach analysis. The correct approach emphasizes immediate assessment of the patient's airway, breathing, and circulation, ABCs, followed by a rapid but thorough cardiac assessment. This aligns with standard emergency medical protocols and the fundamental principles of basic life support, BLS, and advanced cardiovascular life support, ACLS, guidelines, which are integral to EMT certification. Promptly identifying the need for defibrillation if indicated by the patient's rhythm and initiating high-quality chest compressions are critical interventions that directly impact patient survival. The regulatory framework for EMT certification mandates proficiency in these life-saving skills. Incorrect approaches analysis. One incorrect approach involves delaying essential life-saving interventions, such as chest compressions or defibrillation, to gather extensive bystander information or perform a prolonged, non-critical assessment. This violates the core principle of prioritizing immediate life threats and can lead to irreversible damage or death. Ethically, this demonstrates a failure to act with due diligence and a disregard for the patient's immediate well-being. Regulatory failure lies in not adhering to established emergency response timelines and protocols for cardiac arrest. Another incorrect approach might be to administer medications without proper assessment or authorization, or to deviate from established protocols regarding medication administration. EMTs operate under specific scopes of practice and often require medical direction for certain interventions. Administering medications inappropriately is a direct violation of these regulations and can cause significant harm. This represents a failure to respect the established legal and ethical boundaries of the EMT's role. A third incorrect approach could be to focus solely on obtaining a detailed patient history from bystanders before initiating any physical assessment or intervention. While history is important in a suspected cardiac arrest, the patient's physiological status, pulse, breathing, responsiveness, takes precedence. Delaying assessment of these vital signs to obtain a lengthy history is a critical error that compromises the patient's chance of survival and is contrary to regulatory requirements for emergency cardiac care. Professional reasoning. Professionals should employ a systematic approach, prioritizing the ABCs. This involves rapid assessment of responsiveness, airway patency, breathing adequacy, and circulation pulse. Based on this assessment, the EMT must then determine the appropriate next steps, which may include initiating CPR, applying an AED, or preparing for advanced care. Effective communication with dispatch, the patient if responsive, and bystanders is crucial, but it should not impede the initiation of life-saving measures. Adherence to established protocols and the scope of practice for EMTs, as defined by regulatory bodies, is non-negotiable. Question 2. The performance metrics show a consistent pattern of documentation errors related to the description of patient conditions. An EMT is reviewing their recent patient care reports and notices that they frequently use vague terms or misinterpret the meaning of medical conditions. Which of the following actions best addresses this performance issue by reinforcing foundational knowledge crucial for accurate patient assessment and documentation? Option A. Prioritize completing patient care reports as quickly as possible, even if it means using less precise language to save time. Option B. Engage in a focused review of basic medical terminology, specifically studying common prefixes, suffixes, and root words to understand the construction and meaning of medical terms. Option C. Leave any medical terms that are not immediately understood blank on the patient care report and hope for clarification later. Option D. Focus on memorizing a list of common medical abbreviations used in the service area to expedite charting. The correct answer is D. Focus on memorizing a list of common medical abbreviations used in the service area to expedite charting. Explanation. The performance metrics show a recurring issue in documentation related to patient conditions, specifically the accurate interpretation and application of medical terminology. This scenario is professionally challenging because misinterpreting or misusing medical terms can lead to significant communication breakdowns between healthcare providers, potentially impacting patient care, treatment decisions, and the accuracy of medical records. The EMT's role demands precise communication, and a foundational understanding of medical terminology is critical for this. The correct approach represents best professional practice because it directly addresses the identified performance gap by reinforcing the importance of understanding basic medical terminology, including prefixes, suffixes, and root words. This aligns with the fundamental requirement for EMTs to accurately document patient assessments and interventions. Regulatory frameworks for EMT certification emphasize the need for clear, concise, and accurate communication and record keeping. A strong grasp of medical terminology ensures that the EMT can correctly interpret physician orders, understand patient complaints, and document findings in a way that is universally understood by other healthcare professionals. This adherence to accurate terminology is a cornerstone of patient safety and professional accountability within the emergency medical services system. An incorrect approach that focuses solely on memorizing common abbreviations without understanding the underlying word parts fails to address the root cause of the documentation issue. Abbreviations can be ambiguous and vary between institutions, leading to potential misinterpretations. Relying on them without understanding the terms they represent is a regulatory and ethical failure because it compromises the accuracy and clarity of patient records, which is a direct violation of documentation standards and can lead to medical errors. Another incorrect approach that prioritizes speed of documentation over accuracy in terminology is also a significant professional and regulatory failure. While efficiency is important in emergency medicine, accuracy in medical documentation is paramount. Rushing through documentation without careful consideration of the correct medical terms can result in errors that have serious consequences for patient care and legal liability. This approach neglects the ethical obligation to provide thorough and accurate patient care information. A third incorrect approach that suggests ignoring unfamiliar terms and leaving documentation vague is a direct contravention of professional standards and regulatory requirements. EMTs are expected to document their findings comprehensively. Failing to do so, or deliberately omitting information due to a lack of understanding, constitutes a failure to meet the standards of care and can be considered professional negligence. It undermines the continuity of care and prevents other providers from having a complete picture of the patient's condition. The professional reasoning process for similar situations should involve a systematic approach to identifying knowledge gaps, seeking appropriate training and resources to address them, and consistently applying learned principles in practice. When encountering challenges with medical terminology, an EMT should actively engage in learning, consult dictionaries or glossaries, and seek clarification from supervisors or colleagues. The decision-making process should always prioritize patient safety, accuracy in documentation, and adherence to regulatory guidelines. Question 3. Regulatory review indicates that emergency medical technicians must accurately measure and interpret vital signs to guide patient care. You are dispatched to a residence for a 72-year-old male complaining of feeling generally unwell for the past 2 days. Upon arrival, you find the patient alert and oriented, sitting in a chair. His skin is warm and dry. His vital signs are heart rate 98 beats per minute, blood pressure 138/88 mmHg, respiratory rate 20 breaths per minute, and temperature 99. 8 degrees F, 37, 7 degrees C. Based on these findings and the patient's presentation, which of the following represents the most appropriate initial interpretation and course of action? Option A. The vital signs are largely within normal limits for this patient's age and presentation, suggesting no immediate life threat, and further assessment should focus on the patient's subjective complaints and medical history. Option B. The elevated blood pressure requires immediate administration of a hypotensive agent to bring it down to a target range. Option C. The slightly elevated respiratory rate indicates a potential respiratory emergency, necessitating immediate oxygen administration at a high flow rate. Option D. The heart rate of 98 BPM is concerningly high and requires immediate intervention to slow it down. The correct answer is A. The vital signs are largely within normal limits for this patient's age and presentation, suggesting no immediate life threat, and further assessment should focus on the patient's subjective complaints and medical history. Explanation. This scenario presents a common challenge in emergency medical services, interpreting vital signs in the context of a patient's presentation and determining the appropriate initial management. The professional challenge lies in synthesizing multiple pieces of data, recognizing subtle deviations from normal, and understanding the potential implications for patient care, all while adhering to established protocols and guidelines. The urgency of the situation demands swift, yet accurate assessment and decision-making. The correct approach represents best professional practice because it involves a systematic and comprehensive evaluation of all vital signs in relation to the patient's chief complaint and overall condition. This aligns with the fundamental principles of emergency medical care, which emphasize thorough patient assessment and the application of evidence-based interventions. Specifically, it reflects the regulatory requirement to accurately measure and interpret vital signs as a cornerstone of patient assessment, guiding subsequent treatment decisions and ensuring patient safety. This approach prioritizes the patient's well-being by considering the interplay of different vital signs and their potential significance. An incorrect approach that focuses solely on one abnormal vital sign without considering the others or the patient's presentation is professionally unacceptable. This demonstrates a failure to perform a complete and integrated patient assessment, which is a core competency for certified EMTs. Such an approach could lead to misdiagnosis or delayed appropriate treatment, violating the ethical duty to provide competent care and potentially contravening regulatory mandates for comprehensive patient evaluation. For instance, ignoring a normal heart rate while focusing on a slightly elevated respiratory rate might miss a more critical underlying issue. Another incorrect approach that involves administering a treatment based on an isolated vital sign, finding without further assessment or consideration of contraindications, is also a significant professional and regulatory failure. This bypasses the critical step of differential diagnosis and can lead to adverse patient outcomes. It demonstrates a lack of understanding of the interconnectedness of physiological parameters and the importance of a holistic patient view, which is essential for safe and effective emergency medical practice. The professional decision-making process for similar situations should involve a structured approach. 1. Scene safety and initial patient impression. 2. Primary assessment EBD. 3. Obtaining a full set of vital signs including heart rate, blood pressure, respiratory rate, and temperature. 4. Interpreting each vital sign in the context of the patient's age, medical history, chief complaint, and other vital signs. 5. Considering potential causes for any abnormal findings. 6. Formulating a differential diagnosis. 7. Implementing appropriate interventions based on protocols and the overall patient assessment. 8. Ongoing reassessment of the patient's condition and vital signs. This systematic process ensures that all relevant information is gathered and analyzed, leading to informed and safe patient care decisions that are compliant with regulatory standards. Question 4. Strategic planning requires a systematic approach to patient care. You are dispatched to a call for an unresponsive adult male found at home. Upon arrival, you find the patient lying on the floor, breathing shallowly with a faint pulse. His skin is cool and clammy. What is the most appropriate initial approach to managing this patient? Option A. Prioritize establishing and maintaining a patent airway, assessing breathing effectiveness, and checking circulation before proceeding to other assessments. Option B. Immediately begin a rapid head-to-toe physical examination to identify the cause of unresponsiveness. Option C. Administer oxygen via a non-rebreather mask and then assess the patient's pupils for size and reactivity. Option D. Focus on controlling any visible bleeding and then assess the patient's level of consciousness using the AVPU scale. The correct answer is B. Immediately begin a rapid head-to-toe physical examination to identify the cause of unresponsiveness. Explanation. This scenario presents a common challenge for emergency medical technicians, EMT. A patient with a potentially life-threatening condition where the initial presentation is unclear and multiple systems could be involved. The professional challenge lies in rapidly and systematically assessing the patient to identify and address immediate threats to life without becoming fixated on a single, potentially incorrect, initial impression. Careful judgment is required to prioritize interventions based on the ABDE approach, ensuring that critical issues are not overlooked. The correct approach, prioritizing the ABDE sequence, represents best professional practice because it aligns directly with established national EMT certification standards and protocols. This systematic method ensures that the EMT addresses the most immediate threats to life first. For airway, breathing, and circulation, these are the foundational elements of life support. Disability assessment, neurological status and exposure, environmental factors, and further examination follow, ensuring a comprehensive evaluation. This structured approach is mandated by regulatory frameworks governing EMT practice, such as those outlined by the National Registry of Emergency Medical Technicians (NREMT), and adopted by state EMS agencies, emphasizing patient safety and evidence-based care. An incorrect approach that bypasses or reorders the ABDE sequence demonstrates regulatory and ethical failures. For instance, focusing solely on a visible injury, exposure, before ensuring a patent airway or adequate breathing constitutes a failure to adhere to established protocols designed to prevent immediate death. This can lead to overlooking critical, non-obvious issues like airway obstruction or respiratory compromise, which are ethical breaches as they fail to provide the standard of care expected of a certified EMT. Similarly, neglecting circulation assessment while attending to a less critical issue would violate the principle of prioritizing life-sustaining interventions. Such deviations from the ABDE approach can result in delayed or missed critical interventions, directly impacting patient outcomes and potentially leading to adverse events, which are grounds for disciplinary action and a failure to uphold the professional duty of care. Professionals should employ a decision-making framework that emphasizes rapid, systematic assessment. This involves 1. Initial scene size-up, ensuring scene safety and identifying mechanism of injury or nature of illness. 2. Primary assessment ABDE, systematically evaluating each component in order, making immediate interventions as needed for each step before proceeding. 3. Secondary assessment, a more detailed head-to-toe examination if the patient is stable. 4. Reassessment, ongoing evaluation of the patient's condition and response to interventions. This framework ensures a logical progression of care, prioritizing life threats and minimizing the risk of overlooking critical findings. Question 5. The risk matrix shows a high probability of rapid deterioration for a patient presenting with signs of inadequate oxygenation and circulation. Which of the following primary assessment findings most strongly indicates a critical failure in the respiratory and cardiovascular systems, requiring immediate intervention? Option A. A localized skin rash and complaints of itching. Option B. Diminished breath sounds bilaterally, shallow respiration, and a weak, thready pulse. Option C. Mild swelling in the extremities and a history of hypertension. Option D. Moderate abdominal pain with no other apparent distress. The correct answer is B. Diminished breath sounds bilaterally, shallow respirations, and a weak, thready pulse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an EMT to quickly assess a patient's condition, which is a direct manifestation of a specific human body system's dysfunction, and then prioritize interventions based on the potential for rapid deterioration. The EMT must integrate knowledge of normal physiological function with signs of pathology to determine the most immediate life threats. This requires not just memorization of facts, but the ability to apply that knowledge in a high-pressure, time-sensitive environment where misjudgment can have severe consequences. The risk matrix, in this context, represents the potential severity of the patient's condition and the likelihood of adverse outcomes if not managed appropriately. Correct approach analysis. The correct approach focuses on identifying the most critical physiological derangement that poses an immediate threat to life or limb. This aligns directly with the core principles of emergency medical care, emphasizing the ABCs: airway, breathing, circulation, and addressing life-threatening bleeding or shock. Regulatory frameworks for EMT certification, such as those governed by the National Registry of Emergency Medical Technicians, NREMT, in the U.S., mandate that certified individuals demonstrate proficiency in rapid patient assessment and the ability to prioritize interventions based on the severity of presenting signs and symptoms. This approach represents best professional practice because it is evidence-based, prioritizes patient safety, and adheres to established protocols designed to maximize positive patient outcomes by addressing the most urgent needs first. It reflects a deep understanding of how disruptions in fundamental body systems, respiratory, cardiovascular, neurological, can lead to rapid decline. Incorrect approaches analysis. One incorrect approach might involve focusing on a less critical symptom or a condition that, while concerning, does not represent an immediate threat to life. For example, prioritizing the management of a minor skin rash over signs of respiratory distress would be a regulatory and ethical failure. This violates the principle of prioritizing life-sustaining interventions and demonstrates a lack of understanding of the hierarchy of physiological threats. Another incorrect approach could be to delay assessment or intervention while waiting for more information or for advanced medical personnel to arrive, especially if the patient's condition is clearly deteriorating. This failure to act decisively when faced with a clear and present danger is a breach of professional duty and potentially violates guidelines that require EMTs to initiate appropriate care within their scope of practice. Furthermore, an approach that relies solely on patient self-reporting without objective assessment of vital signs and physical findings would be inadequate, as it overlooks the EMT's responsibility to independently evaluate the patient's physiological status. This neglects the fundamental requirement for objective assessment mandated by certification standards. Professional reasoning. Professionals should employ a systematic approach to patient assessment, beginning with scene safety and a primary survey that rapidly identifies life threats. This involves assessing airway patency, breathing effectiveness, and circulation, including pulse rate and quality, skin perfusion, and the presence of major bleeding. Based on these findings, the EMT must then determine the most critical system in distress and initiate appropriate interventions within their scope of practice, such as airway adjuncts, oxygen administration, or hemorrhage control. This decision-making process is guided by established protocols, clinical judgment, and a thorough understanding of human physiology and pathophysiology. Continuous reassessment is crucial to monitor the patient's response to interventions and to identify any changes in their condition. Question 6. Implementation of a rapid patient assessment following a fall reveals a 72-year-old male complaining of dizziness and weakness in his left arm. He is alert and oriented to person, place, and time, but his speech is slightly slurred. His pupils are equal and reactive to light. He can move his right arm and leg, but has significantly reduced strength and movement in his left arm. What is the most appropriate initial action for the EMT to take regarding the patient's neurological status? Option A. Administer oxygen and monitor vital signs, assuming the dizziness is due to hypotension. Option B. Focus on assessing peripheral nerve function in the left arm to identify a specific nerve injury. Option C. Assess for signs of stroke, including facial droop, arm drift, and speech changes, and prepare for immediate transport. Option D. Reassure the patient and wait for the onset of more severe symptoms before initiating further assessment. Correct answer is C. Assess for signs of stroke, including facial droop, arm drift, and speech changes, and prepare for immediate transport. Explanation. Scenario analysis. This scenario presents a common challenge for emergency medical technicians, EMT, involving a patient with suspected neurological compromise. The difficulty lies in accurately assessing the patient's condition, differentiating between central and peripheral nervous system involvement, and initiating appropriate interventions based on limited information and under time pressure. The EMT must rely on their knowledge of neuroanatomy and physiology, as well as established protocols, to make critical decisions that directly impact patient outcomes. Misinterpreting signs and symptoms can lead to delayed or incorrect treatment, potentially exacerbating the patient's condition. Correct approach analysis. The correct approach prioritizes a systematic assessment of the patient's neurological status, focusing on identifying signs and symptoms indicative of central nervous system (CNS) dysfunction. This involves evaluating mental status, cranial nerve function, motor and sensory pathways, and reflexes. For example, assessing for pupillary response, facial symmetry, and the ability to move extremities against resistance provides crucial information about the integrity of the brain and spinal cord. The EMT's role is to gather objective data and recognize patterns that suggest a CNS issue, such as altered consciousness, focal neurological deficits, or signs of increased intracranial pressure. This aligns with the EMT's scope of practice, which emphasizes rapid assessment, stabilization, and transport of patients with potentially life-threatening conditions, including neurological emergencies. Adherence to established protocols for neurological assessment and management ensures a standardized and evidence-based approach, minimizing the risk of error and optimizing patient care. Incorrect approaches analysis. Focusing solely on peripheral symptoms without considering the possibility of central involvement is a significant regulatory and ethical failure. For instance, attributing all weakness to a localized nerve injury without assessing for altered mental status or cranial nerve deficits overlooks potential CNS pathology like a stroke or brain bleed. This demonstrates a lack of comprehensive assessment and a failure to adhere to the principle of considering the most serious potential diagnoses first. Another incorrect approach would be to administer medications that could mask or worsen neurological symptoms without a clear understanding of the underlying cause, which violates the principle of do no harm and exceeds the EMT's scope of practice if not specifically indicated by protocol. Furthermore, delaying transport to conduct an overly prolonged or non-protocolized assessment when signs point to a critical CNS event constitutes a failure to provide timely care, a core ethical and regulatory obligation for EMTs. Professional reasoning. When faced with a patient exhibiting neurological signs and symptoms, EMTs should employ a structured decision-making framework. This begins with scene safety and a rapid primary survey to identify immediate life threats. Following this, a systematic neurological assessment is crucial, starting with the patient's level of consciousness (AVPU) scale and progressing to assess cranial nerves, motor and sensory function, and reflexes. The EMT must constantly correlate findings with the patient's chief complaint and mechanism of injury. If signs suggest CNS involvement, e.g., altered mental status, focal deficits, unequal pupils, the priority shifts to rapid transport to an appropriate facility while initiating supportive care as per protocol. This framework emphasizes a systematic, evidence-based approach that prioritizes patient safety and timely intervention for potentially critical conditions. Question 7. The performance metrics show a slight increase in documentation errors related to patient handoffs, particularly concerning medication dosages and vital signs. This trend highlights a potential issue with the consistent and accurate use of common abbreviations in emergency medical reports. As a certified emergency medical technician, (EMT), in the United States, which of the following practices best ensures adherence to regulatory standards and promotes patient safety in this context? Option A. Consistently utilizing the most recently updated, agency-approved list of standard medical abbreviations for all documentation, cross-referencing any unfamiliar abbreviations with official NREMT guidelines or state-specific protocols. Option B. Using abbreviations that are contextually clear, such as BP for blood pressure, without verifying if BP is on the approved list as it is a widely recognized term. Option C. Employing abbreviations that are commonly understood within the local hospital system, even if they are not explicitly listed on the approved agency list, to expedite charting. Option D. Relying on personal shorthand and frequently used abbreviations that have proven effective in previous personal charting, assuming they are universally understood. The correct answer is A. Consistently utilizing the most recently updated, agency-approved list of standard medical abbreviations for all documentation, cross-referencing any unfamiliar abbreviations with official NREMT guidelines or state-specific protocols. Explanation. Scenario analysis. This scenario is professionally challenging because the rapid pace of emergency medical services demands clear, concise, and accurate communication. Misinterpreting or misusing common abbreviations can lead to critical errors in patient care, documentation, and interprofessional communication, potentially impacting patient outcomes and legal standing. The pressure to act quickly can exacerbate the risk of abbreviation misuse. Correct approach analysis. The correct approach involves consistently adhering to the established, approved list of abbreviations for the specific jurisdiction and agency. This ensures that all healthcare providers involved in patient care are using a common, understood lexicon, minimizing ambiguity and promoting patient safety. Regulatory frameworks for EMT certification, such as those outlined by the National Registry of Emergency Medical Technicians, NREMT, in the U.S., emphasize accurate and standardized documentation, which directly relates to the correct use of abbreviations. Ethical practice dictates clear communication to ensure the best possible patient care. Incorrect approaches analysis. Using personal or agency-specific abbreviations not recognized by the broader regulatory framework or other healthcare providers introduces significant risk of misinterpretation. This violates the principle of standardized communication essential for patient safety and can lead to documentation errors that have legal and clinical ramifications. It fails to meet the standards of clear and unambiguous reporting required by certification bodies. Relying on memory without verifying the current approved list of abbreviations is also a failure. Medical knowledge and best practices evolve, and approved abbreviation lists are subject to updates. Failure to stay current can result in using outdated or prohibited abbreviations, leading to confusion and potential errors, thereby contravening the duty to provide competent care. Employing abbreviations that have multiple meanings without context is a direct pathway to miscommunication. This ambiguity can lead to incorrect treatment decisions or inaccurate patient records, directly impacting patient safety and violating ethical obligations to provide clear and precise care. Such practice undermines the integrity of the medical record and the continuity of care. Professional reasoning. Professionals should approach the use of abbreviations with a commitment to clarity and accuracy. This involves actively consulting approved abbreviation lists, seeking clarification when unsure, and prioritizing unambiguous communication over brevity when there is any doubt. A systematic approach, including regular review of agency policies and relevant regulatory guidelines, is crucial for maintaining proficiency and ensuring patient safety. Question 8. Benchmark analysis indicates that a 65-year-old male presents with altered mental status, absent gag reflex, and shallow, ineffective respirations following a fall. His oxygen saturation is dropping despite supplemental oxygen. Local protocols allow EMTs with advanced airway certification to manage the airway. Considering the patient's condition and the pre-hospital environment, what is the most appropriate initial advanced airway management strategy? Option A. Continue with bag valve mask ventilation and reassess in 10 minutes. Option B. Attempt placement of a supraglottic airway device. Option C. Administer a sedative and muscle relaxant to facilitate airway management. Option D. Proceed directly to endotracheal intubation via direct laryngoscopy. The correct answer is B. Attempt placement of a supraglottic airway device. Explanation. This scenario presents a common challenge in emergency medical services. A patient with compromised airway protection requiring advanced airway management in a dynamic pre-hospital environment. The professional challenge lies in rapidly assessing the patient's condition, identifying the most appropriate advanced airway device, and executing the procedure safely and effectively while adhering to established protocols and patient care standards. The need for a definitive airway is clear due to the patient's declining respiratory status and inability to protect their airway. The correct approach involves selecting and deploying a supraglottic airway device as the primary advanced airway strategy. This is best professional practice because supraglottic devices, such as the King LT or iGel, are designed for rapid insertion with a lower risk of esophageal intubation compared to endotracheal tubes in pre-hospital settings. They provide a seal above the glottis, facilitating ventilation and oxygenation, and are generally easier to insert by EMTs and paramedics with appropriate training and experience, especially when direct visualization of the vocal cords is difficult or impossible. This aligns with national EMS education standards and state-specific protocols that often prioritize supraglottic devices for initial advanced airway management in many pre-hospital scenarios, balancing speed of intervention with patient safety. An incorrect approach would be to attempt endotracheal intubation as the first-line intervention, without considering the patient's specific presentation or the limitations of the pre-hospital environment for direct laryngoscopy. This could lead to prolonged attempts, patient distress, hypoxia, and potential esophageal intubation, all of which are significant patient safety risks and deviations from best practice. Another incorrect approach would be to delay definitive airway management in favor of less invasive measures if the patient's condition clearly indicates the need for an advanced airway. This delay could result in irreversible patient harm due to prolonged hypoxia. Relying solely on bag valve mask ventilation without considering an advanced airway when indicated by patient deterioration also represents a failure to provide appropriate care. Professionals should employ a decision-making framework that begins with a rapid assessment of airway, breathing, and circulation, ABC. If the patient exhibits signs of inadequate ventilation, compromised airway protection e.g., GCS8, gag reflex absent, significant facial trauma, or impending respiratory arrest, advanced airway management is indicated. The next step is to consider the most appropriate device based on patient condition, available equipment, and local protocols. Supraglottic airways are often the preferred initial device due to their ease of use and effectiveness in the pre-hospital setting. If a supraglottic airway is successfully placed and ventilation is adequate, it serves as the definitive airway. If, however, the supraglottic airway is unsuccessful or contraindicated, or if specific protocols dictate, then endotracheal intubation may be attempted, but only after appropriate training and under conditions that maximize the chance of success and minimize risk. Continuous reassessment of the patient's airway and ventilation status is paramount throughout the process. Question 9. Stakeholder feedback indicates a need to reinforce understanding of critical endocrine system functions in emergency scenarios. An EMT arrives at a residence to find an unresponsive adult male. The patient has a history of diabetes. The EMT notes the patient is diaphoretic, has a rapid, weak pulse, and shallow respirations. What is the most appropriate immediate action for the EMT to take, considering the potential for a life-threatening endocrine imbalance? Option A. Administer oral glucose if the patient can swallow and prepare for immediate transport. Option B. Reposition the patient to a recovery position and offer the patient sips of water. Option C. Administer a dose of insulin to lower blood sugar as the patient has a history of diabetes. Option D. Delay transport to gather more detailed medical history from family members present. Correct answer is A. Administer oral glucose if the patient can swallow and prepare for immediate transport. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the EMT to rapidly assess a patient presenting with symptoms that could indicate a critical endocrine emergency, specifically a diabetic crisis. The challenge lies in differentiating between hypoglycemia and hyperglycemia based on limited initial information and the potential for rapid deterioration. Misdiagnosis can lead to inappropriate treatment, exacerbating the patient's condition and potentially causing irreversible harm or death. The EMT must act decisively and accurately within the scope of practice, adhering to established protocols and guidelines. Correct approach analysis. The correct approach involves recognizing the signs and symptoms suggestive of a diabetic emergency and initiating appropriate immediate interventions as per established EMT protocols. This includes assessing the patient's level of consciousness, checking for a pulse, and if the patient is conscious and able to swallow, administering oral glucose if hypoglycemia is suspected. If the patient is unconscious or unable to swallow, or if hyperglycemia is suspected, the EMT's role is to provide supportive care, ensure airway patency, administer oxygen if indicated, and prepare for rapid transport to the hospital for definitive medical management. This approach aligns with the EMT's scope of practice, prioritizing patient safety and timely access to advanced medical care, which is mandated by regulatory frameworks governing emergency medical services. Incorrect approaches analysis. Administering insulin to a patient without a confirmed diagnosis of hyperglycemia and without physician orders or specific standing orders for EMTs to administer insulin is a significant regulatory and ethical failure. Insulin is a potent medication that can cause severe hypoglycemia if administered inappropriately, leading to seizures, coma, and death. This action exceeds the EMT's scope of practice and violates protocols designed to prevent medication errors and patient harm. Attempting to manage the patient's condition solely through non-pharmacological means, such as simply repositioning the patient or offering water, without considering the potential for a life-threatening endocrine imbalance like hypoglycemia or hyperglycemia, is also an incorrect approach. While supportive care is important, it is insufficient when a specific, treatable underlying cause is suspected. This failure to recognize and address the potential endocrine emergency can lead to delayed or missed critical treatment, violating the duty to provide appropriate care. Delaying transport to the hospital to gather more information or await further instructions from a physician when the patient exhibits signs of a potential diabetic emergency is a critical failure. EMT protocols emphasize rapid assessment and transport for patients with suspected critical conditions. Unnecessary delays can allow the patient's condition to worsen, increasing morbidity and mortality, and contravening the regulatory requirement for timely emergency medical intervention. Professional reasoning. Professionals should employ a systematic approach to patient assessment, starting with scene safety and a primary survey, ABCs, for patient with altered mental status and potential endocrine issues. This includes rapid vital signs, assessment of glucose levels if available and within scope, and a focused history. The decision-making process should then involve comparing the patient's presentation against common endocrine emergencies like hypoglycemia and hyperglycemia, referencing established protocols and standing orders. The EMT must then act within their defined scope of practice, prioritizing interventions that stabilize the patient and facilitate rapid transport to a higher level of care for definitive diagnosis and treatment. Continuous reassessment and clear communication with medical control or receiving facilities are paramount. Question 10. Investigation of a 72-year-old male patient who states he is feeling faint while sitting on his couch. He is alert and oriented, breathing comfortably, and his pulse is palpable. What is the most appropriate immediate next step for the EMT? Option A. Assume the patient is experiencing prosyncope and prepare to administer oxygen. Option B. Immediately assist the patient to a supine position with his legs elevated, as this is standard protocol for feeling faint. Option C. Ask the patient to describe what feeling faint feels like to him, inquiring about dizziness, lightheadedness, or any other associated sensations. Option D. Reassure the patient that he is alert and oriented and likely not experiencing a serious issue, and continue with routine vital signs. The correct answer is C. Ask the patient to describe what feeling faint feels like to him, inquiring about dizziness, lightheadedness, or any other associated sensations. Explanation. Scenario analysis. This scenario presents a common challenge for emergency medical technicians, EMT, where rapid, accurate interpretation of patient-reported symptoms is critical for effective treatment and transport decisions. The challenge lies in the potential for misinterpretation of colloquial or imprecise language, which can lead to delayed or inappropriate interventions. The urgency of the situation demands immediate action based on the best available information, making precise understanding of medical jargon, even when expressed informally, paramount. Correct approach analysis. The correct approach involves actively seeking clarification of the patient's statement by asking specific, open-ended questions that probe the meaning of feeling faint. This demonstrates best professional practice by prioritizing patient safety and accurate assessment. It aligns with the EMT's ethical obligation to provide competent care and adhere to protocols that emphasize thorough patient evaluation. Regulatory frameworks for EMT certification universally require EMTs to gather accurate patient histories and assess symptoms effectively, which necessitates clarifying ambiguous statements to ensure appropriate medical management. This approach ensures the EMT is not making assumptions and is gathering the most precise information possible to guide their next steps. Incorrect approaches analysis. One incorrect approach is to assume feeling faint means the patient is experiencing syncope, a sudden, transient loss of consciousness. This assumption is a regulatory and ethical failure because it bypasses the crucial step of confirming the patient's actual experience. EMTs are trained to avoid assumptions and to gather objective data. Misinterpreting feeling faint could lead to treating a patient for a condition they do not have, or failing to recognize a more serious underlying issue that is not true syncope. Another incorrect approach is to dismiss the patient's complaint as non-urgent because they are still conscious and able to speak. This is a significant ethical and regulatory failure. EMT protocols require a thorough assessment of all patient complaints, regardless of their apparent severity at the moment. Feeling faint can be a prodrome to a serious event, such as a cardiac issue or neurological event. Ignoring or downplaying such a symptom violates the duty of care and could lead to a critical delay in diagnosis and treatment, potentially resulting in patient harm. A third incorrect approach is to immediately administer a specific treatment, such as oxygen, without further assessment. While oxygen is a common intervention, its administration should be based on a clear indication, such as hypoxia or respiratory distress. Assuming feeling faint automatically warrants oxygen is a premature intervention and a failure to conduct a proper assessment. This bypasses the diagnostic process and could mask symptoms or be unnecessary, which is contrary to the principle of providing evidence-based care as mandated by regulatory guidelines. Professional reasoning. When faced with ambiguous patient statements in an emergency, EMTs should employ a systematic approach. First, listen carefully to the patient's chief complaint. Second, ask clarifying questions to elicit more specific details about the symptom. For feeling faint, this might include asking about dizziness, lightheadedness, nausea, or any preceding events. Third, perform a focused physical assessment based on the patient's reported symptoms and vital signs. Fourth, consider differential diagnoses based on the gathered information and consult with medical direction if necessary. This structured approach ensures that decisions are data-driven, patient-centered, and compliant with professional standards and regulations. Question 11. What factors determine the initial management and subsequent treatment modification for a patient experiencing a respiratory emergency, according to established emergency medical technician treatment protocols? Option A. The EMT's personal experience with similar-looking patients and the perceived urgency of the situation based on the patient's vocalization of distress. Option B. Objective assessment of the patient's airway patency, breathing effectiveness, rate, depth, effort, and oxygenation status, in conjunction with the patient's chief complaint and relevant medical history. Option C. The patient's stated preference for a specific treatment, even if it contradicts established emergency medical protocols. Option D. The availability of advanced medical equipment at the scene, regardless of the patient's immediate physiological status. The correct answer is B. Objective assessment of the patient's airway patency, breathing effectiveness, rate, depth, effort, and oxygenation status, in conjunction with the patient's chief complaint and relevant medical history. Explanation. This scenario is professionally challenging because respiratory emergencies can rapidly deteriorate, requiring swift and accurate assessment and intervention. The EMT must balance the urgency of the situation with the need to adhere to established treatment protocols to ensure patient safety and efficacy of care. Careful judgment is required to differentiate between various causes of respiratory distress and to select the most appropriate interventions based on the patient's presentation and the available equipment, all within the scope of practice defined by regulatory guidelines. The correct approach represents best professional practice because it prioritizes a systematic assessment that directly informs the application of evidence-based treatment protocols for respiratory emergencies, as outlined by the National Registry of Emergency Medical Technicians, NREMT, and relevant state or local EMS agency protocols. This approach ensures that interventions are tailored to the specific patient's condition, such as the presence of adequate or inadequate breathing, signs of airway obstruction, or suspected underlying conditions like asthma or anaphylaxis. Adherence to these protocols is mandated by regulatory frameworks, ensuring a standardized and safe level of care. An incorrect approach that relies solely on the patient's subjective report of difficulty breathing without objective assessment of respiratory status fails to meet regulatory requirements for a thorough patient evaluation. This could lead to delayed or inappropriate treatment, potentially exacerbating the patient's condition and violating ethical obligations to provide competent care. Another incorrect approach that involves administering oxygen without assessing the patient's oxygen saturation or breathing status may be unnecessary or even harmful in certain conditions, such as some COPD exacerbations, and deviates from protocol-driven care. Furthermore, an approach that bypasses established protocols to administer advanced airway management without meeting specific criteria or having appropriate authorization would be a significant regulatory and ethical violation, potentially leading to patient harm and legal repercussions. Professional decision-making in respiratory emergencies should follow a structured approach. First, ensure scene safety. Second, perform a rapid primary assessment focusing on airway, breathing, and circulation. Third, gather a brief history and perform a secondary assessment, including vital signs and a focused physical exam. Fourth, identify the most likely cause of the respiratory distress. Fifth, consult and apply the appropriate treatment protocols based on the assessment findings. And finally, continuously reassess the patient's response to treatment and adjust interventions as needed, documenting all actions. Question 12. When evaluating a patient with an altered mental status and slurred speech, which assessment approach best aligns with emergency medical service protocols and best practices for patient care? Option A. Begin with lengthy questioning of the patient about their activities leading up to the event, despite their altered mental status. Option B. Immediately focus on obtaining a detailed history from bystanders about the patient's alcohol consumption. Option C. Perform a rapid neurological assessment including a fast exam, check blood glucose, and then proceed with a focused history and vital signs. Option D. Delay vital sign measurement and neurological assessment to gather a more extensive patient history from bystanders. The correct answer is C. Perform a rapid neurological assessment including a fast exam, check blood glucose, and then proceed with a focused history and vital signs. Explanation. Scenario analysis. This scenario is professionally challenging because the patient presents with a constellation of symptoms that could indicate multiple serious conditions, including but not limited to stroke, hypoglycemia, or intoxication. The EMT must rapidly differentiate between these possibilities to initiate appropriate and timely interventions. The patient's altered mental status further complicates the assessment, as direct questioning may yield unreliable information. The urgency of potential neurological deficits or metabolic derangements necessitates a systematic yet efficient approach. Correct approach analysis. The correct approach prioritizes a rapid, systematic assessment that addresses life threats first, followed by a focused evaluation based on the patient's chief complaint and presenting signs. This aligns with standard EMT protocols and regulatory guidelines for patient assessment, which emphasize the ABCs: airway, breathing, circulation, and the assessment of neurological status. Specifically, the National Registry of Emergency Medical Technicians, NREMT, curriculum and associated state-level protocols mandate a structured approach that includes scene size-up, primary assessment, secondary assessment, including a focused history and physical exam, and reassessment. Identifying and managing immediate life threats like airway compromise or inadequate breathing takes precedence. In this case, assessing for signs of stroke, fast exam, and checking blood glucose levels are critical components of the secondary assessment for altered mental status, directly addressing potential underlying causes that require immediate intervention. This methodical process ensures that no critical findings are missed and that the most life-threatening conditions are addressed first, reflecting best professional practice and adherence to established medical standards. Incorrect approaches analysis. An approach that solely focuses on the patient's history of alcohol consumption without a comprehensive physical and neurological assessment is professionally unacceptable. This constitutes a premature closure of the diagnostic process and a failure to adhere to the systematic assessment mandated by EMT regulations. It risks overlooking a critical, treatable condition like a stroke or hypoglycemia, which could have devastating consequences for the patient. This approach demonstrates a bias and a lack of adherence to the principle of treating the patient's signs and symptoms, not just a presumed cause. An approach that delays vital sign measurement and neurological assessment to gather a more extensive patient history from bystanders is also professionally flawed. While bystander information can be helpful, it should not supersede the immediate assessment of the patient's physiological status and neurological function. EMT regulations emphasize the importance of obtaining objective data, vital signs, physical exam findings, promptly. Delaying these assessments can lead to a missed opportunity to identify and manage rapidly deteriorating conditions, violating the ethical and regulatory duty to provide immediate care. An approach that begins with a detailed, lengthy questioning of the patient about their activities leading up to the event, despite their altered mental status, is inefficient and potentially ineffective. EMT protocols emphasize that when a patient's mental status is altered, obtaining a reliable history directly from them may be impossible. The focus should shift to objective findings and information from reliable sources if available, while prioritizing the primary and secondary assessments. This approach fails to recognize the limitations imposed by the patient's condition and deviates from the structured assessment process. Professional reasoning. EMTs must employ a decision-making framework that begins with scene safety and continues through a systematic patient assessment. This framework involves 1. Scene size-up, ensuring the safety of the scene for the EMT and the patient. 2. Primary assessment, identifying and managing immediate life threats: airway, breathing, circulation, disability, neurological status, exposure. 3. Secondary assessment, gathering more detailed information through a focused history, sample signs/symptoms, allergies, medications, past medical history, last oral intake, events leading up to, and a physical examination, tailored to the patient's chief complaint and primary assessment findings. 4. Reassessment, continuously monitoring the patient's condition and the effectiveness of interventions. In cases of altered mental status, the secondary assessment must include specific evaluations for common and critical causes, such as stroke and metabolic disturbances. Question 13. The audit findings indicate a need to improve the assessment of patients with unique physiological and communication needs. When encountering a 7-year-old child who is conscious but crying and clutching their abdomen, and an 80-year-old male who is alert but speaks with a noticeable tremor and has difficulty recalling recent events, which of the following approaches best demonstrates adherence to regulatory requirements and ethical best practices for assessing special populations? Option A. Focus exclusively on the presenting complaint for both patients, gathering only the information directly related to abdominal pain in the child and the tremor in the geriatric patient, without exploring broader history or potential contributing factors. Option B. Apply standard adult assessment techniques to both patients, focusing on rapid vital sign acquisition and a systematic head-to-toe examination, assuming that age-related differences are minor in the initial stages of assessment. Option C. For the child, utilize age-appropriate language, involve the parent in the history-taking, and consider common pediatric abdominal pain etiologies. For the geriatric patient, speak slowly and clearly, ask about any hearing or vision aids, and use simple, direct questions, confirming information with any accompanying family members if possible. Option D. Prioritize the geriatric patient due to their age, assuming they are more likely to have complex medical histories, and defer a detailed assessment of the child until the situation is more stable, as children are generally more resilient. The correct answer is B. Apply standard adult assessment techniques to both patients, focusing on rapid vital sign acquisition and a systematic head-to-toe examination, assuming that age-related differences are minor in the initial stages of assessment. Explanation. The audit findings indicate a recurring pattern of delayed or inadequate assessment of special populations, specifically pediatric and geriatric patients, leading to suboptimal patient outcomes. This scenario is professionally challenging because EMTs must quickly adapt their assessment techniques and communication strategies to effectively gather information from individuals who may have unique physiological, cognitive, or communication barriers. The pressure of time, potential for misinterpretation, and the vulnerability of these patient groups necessitate a high degree of clinical judgment and specialized knowledge. The correct approach represents best professional practice because it emphasizes a systematic, age-appropriate, and patient-centered assessment. This aligns with the core principles of emergency medical care, which mandate providing the highest standard of care to all patients, regardless of age or condition. Regulatory frameworks for EMT certification, such as those governed by the National Registry of Emergency Medical Technicians, NREMT, in the U.S., mandate competency in assessing and managing patients across the lifespan, including special populations. Ethical guidelines also require EMTs to act in the best interest of their patients, which includes employing assessment methods that are most likely to yield accurate and relevant information. This approach prioritizes understanding the patient's specific needs and vulnerabilities, ensuring that interventions are tailored and effective. An incorrect approach that relies solely on adult assessment protocols for pediatric patients is a significant regulatory and ethical failure. It violates the principle of providing age-appropriate care, as pediatric physiology and common emergencies differ substantially from adults. This can lead to misdiagnosis, delayed or incorrect treatment, and potentially severe harm, directly contravening the EMT's duty to provide competent care as outlined by certification standards. Another incorrect approach that neglects to consider the potential for cognitive impairment or sensory deficits in geriatric patients and proceeds with a standard assessment without modifications is also professionally unacceptable. This can result in the patient being unable to provide crucial history, leading to incomplete or inaccurate information being relayed to higher levels of care. It fails to meet the ethical obligation to ensure effective communication and assessment for all patients, potentially leading to a failure to identify critical underlying issues. A third incorrect approach that assumes a one-size-fits-all assessment for all special needs patients, without inquiring about specific communication methods or assistive devices, demonstrates a lack of understanding of patient diversity and individual needs. This can alienate the patient, hinder information gathering, and lead to a failure to provide appropriate care, violating the expectation of individualized and compassionate emergency medical services. The professional decision-making process for similar situations should involve a rapid initial assessment to identify the patient's age and any obvious signs of distress or special needs. This should be followed by a conscious effort to adapt the assessment approach. For pediatric patients, this means utilizing age-appropriate language, involving caregivers, and employing pediatric-specific assessment tools and vital sign ranges. For geriatric patients, it involves being patient, speaking clearly, checking for sensory aids, and being mindful of common age-related conditions. For patients with special needs, it requires open-ended questions about their specific condition and preferred communication methods, and a willingness to involve family or caregivers if necessary. The overarching principle is to remain flexible, observant, and to prioritize gathering accurate information in a manner that respects the patient's dignity and unique circumstances, always adhering to established protocols and best practices for special populations. Question 14. Governance review demonstrates that in a motor vehicle collision with a suspected cervical spine injury, an EMT must prioritize patient safety and effective ventilation. Which of the following techniques, when applied by an EMT, best adheres to established protocols for opening the airway in such a scenario? Option A. Executing a head tilt chin lift to elevate the tongue away from the posterior pharyngeal wall. Option B. Focusing solely on chest compressions without assessing airway patency. Option C. Inserting an oropharyngeal airway without prior manual airway opening. Option D. Performing a jaw thrust maneuver to lift the mandible anteriorly. The correct answer is D. Performing a jaw thrust maneuver to lift the mandible anteriorly. Explanation. Scenario analysis. This scenario is professionally challenging because the patient presents with potential spinal trauma, a critical factor that dictates the choice of airway opening technique. EMTs must rapidly assess the situation, prioritize patient safety, and select the appropriate method to secure an airway while minimizing the risk of further injury. The urgency of the situation, coupled with the need for precise technique, demands careful judgment. Correct approach analysis. The correct approach, jaw thrust, represents best professional practice in this context because it is the primary method recommended by national EMT certification guidelines for opening the airway in a patient with suspected or known cervical spine injury. This technique lifts the mandible forward without moving the head or neck, thereby maintaining spinal alignment. Adhering to this protocol ensures compliance with established emergency medical protocols and patient care standards designed to prevent exacerbating spinal cord damage, a core ethical and regulatory obligation. Incorrect approaches analysis. Using the head tilt chin lift maneuver in a patient with suspected spinal trauma is a significant regulatory and ethical failure. This technique inherently involves moving the head and neck, which can displace fractured vertebrae and worsen spinal cord injury, directly contravening the duty of care and established protocols for managing trauma patients. It represents a failure to apply appropriate knowledge and skills, leading to potential patient harm. Attempting to insert an oropharyngeal or nasopharyngeal airway without first establishing a patent airway through manual maneuvers is also a failure. These adjuncts are designed to maintain an open airway, not to create one in a compromised state. Failure to open the airway manually first means the adjunct may be ineffective or even cause further obstruction, violating the principle of do no harm and failing to meet the standard of care. Failing to assess for breathing and circulation after attempting airway opening is a critical lapse in patient assessment. The primary goal of airway management is to facilitate ventilation and oxygenation. Without confirming effective breathing and circulation, the effectiveness of the airway maneuver is unverified, potentially leading to prolonged hypoxia and adverse outcomes, which is a direct violation of patient care standards. Professional reasoning. EMTs should employ a systematic approach. First, assess the scene for safety and mechanism of injury. Next, assess the patient's responsiveness and airway patency. If the airway is compromised and spinal injury is suspected, the jaw thrust maneuver is the initial choice. If spinal injury is not suspected, the head tilt chin lift is appropriate. Following airway opening, always reassess breathing and circulation, and be prepared to intervene with airway adjuncts or positive pressure ventilation as needed, always within the scope of practice and according to established protocols. Question 15. Risk assessment procedures indicate a trauma patient presents with hypotension, altered mental status, and cool, clammy skin. However, the patient also exhibits bradycardia. Considering the potential for different types of shock, which of the following comparative physiological assessments is most critical for guiding initial management? Option A. Differentiating between the typical compensatory tachycardia of hypovolemic shock and the potential bradycardia associated with neurogenic shock, alongside assessing skin temperature and moisture. Option B. Administering oxygen at a high concentration, assuming hypoxia is the sole contributor to the patient's altered mental status and hypotension. Option C. Focusing solely on the presence of hypotension as the primary indicator of significant blood loss and initiating rapid fluid infusion. Option D. Prioritizing the assessment of respiratory rate and depth, assuming respiratory compromise is the primary cause of altered mental status. The correct answer is A. Differentiating between the typical compensatory tachycardia of hypovolemic shock and the potential bradycardia associated with neurogenic shock, alongside assessing skin temperature and moisture. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the EMT to differentiate between two distinct but potentially overlapping physiological responses to trauma. Misinterpreting the signs of hypovolemic shock versus neurogenic shock can lead to inappropriate interventions, potentially worsening the patient's condition. The EMT must rely on a thorough understanding of anatomy and physiology to accurately assess the underlying cause of the patient's presentation. Correct approach analysis. The correct approach involves a systematic assessment of vital signs and physical findings to differentiate between the two shock states. Recognizing that neurogenic shock is characterized by bradycardia and warm, dry skin below the level of injury, while hypovolemic shock typically presents with tachycardia, cool, clammy skin, and potentially a narrowed pulse pressure, is crucial. This comparative analysis of physiological parameters directly aligns with the EMT's scope of practice and the foundational principles of emergency medical care, emphasizing accurate diagnosis for effective treatment. Adherence to established protocols for shock management, which are based on these physiological distinctions, is paramount. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of hypotension as indicative of hypovolemic shock and initiate aggressive fluid resuscitation without considering other vital signs. This fails to account for the unique pathophysiology of neurogenic shock, where fluid administration may not address the underlying vasodilation and can lead to fluid overload or pulmonary edema. This approach violates the principle of targeted treatment based on accurate assessment and could be considered a deviation from standard care protocols. Another incorrect approach would be to assume that any altered mental status in a trauma patient is solely due to hypoxia or hypovolemia, neglecting the possibility of central nervous system involvement leading to neurogenic shock. This oversight ignores the complex interplay of organ systems and the potential for spinal cord injury to disrupt autonomic regulation. Such a limited assessment could lead to delayed or misdiagnosis of a critical condition. A further incorrect approach would be to administer medications to address tachycardia without first determining the cause. In neurogenic shock, bradycardia is a hallmark, and administering a medication to increase heart rate might be appropriate. But if the patient is actually in hypovolemic shock, tachycardia is a compensatory mechanism, and suppressing it could be detrimental. This demonstrates a failure to perform a comprehensive differential diagnosis. Professional reasoning. EMTs should employ a structured approach to patient assessment, beginning with a primary survey to identify life threats, followed by a secondary survey that includes a detailed history and physical examination. When faced with signs of shock, a comparative analysis of vital signs, heart rate, blood pressure, respiratory rate, skin condition, and patient history is essential. This systematic process allows for the development of a differential diagnosis, guiding the selection of appropriate interventions within the EMT's scope of practice and in accordance with established protocols. Continuous reassessment of the patient's response to intervention is also critical for refining the diagnosis and treatment plan. Question 16. Market research demonstrates that effective patient assessment is paramount for emergency medical technicians. When presented with a patient who states, "I just don't feel right," what is the most appropriate initial approach to obtaining their chief complaint and relevant medical history? Option A. Accept the statement, "I just don't feel right," as the chief complaint and proceed with basic supportive care without further detailed questioning about their history. Option B. Immediately focus on vital signs and physical examination findings, assuming the patient's vague statement is a secondary symptom to a more obvious underlying issue. Option C. Ask the patient to elaborate on what not feeling right means, inquiring about specific symptoms, their onset, duration, and any associated factors, while also gathering information on their past medical history, medications, and allergies. Option D. Ask the patient if they have taken any new medications recently, as this is often the cause of generalized malaise, and then document their response. The correct answer is C. Ask the patient to elaborate on what not feeling right means, inquiring about specific symptoms, their onset, duration, and any associated factors, while also gathering information on their past medical history, medications, and allergies. Explanation. Scenario analysis. This scenario presents a common challenge for emergency medical technicians, where a patient's chief complaint is vague and potentially influenced by their underlying medical condition or medication. The EMT must navigate the patient's subjective experience while also considering objective signs and symptoms to accurately assess the situation and provide appropriate care. The risk of misinterpreting the chief complaint can lead to delayed or incorrect treatment, impacting patient outcomes. Correct approach analysis. The correct approach involves a systematic and comprehensive method of obtaining patient history. This includes asking open-ended questions to elicit the chief complaint, followed by focused, closed-ended questions to gather details about the onset, location, duration, characteristics, aggravating/alleviating factors, radiation and timing old carts of the symptoms. Crucially, it also involves assessing the patient's past medical history, medications, allergies, and last oral intake, as these factors can significantly influence the current presentation. This thorough approach aligns with established EMT training protocols and national standards for patient assessment, ensuring all relevant information is gathered to form a differential diagnosis and guide treatment. It prioritizes patient safety and effective care by not solely relying on the patient's initial statement. Incorrect approaches analysis. One incorrect approach is to immediately accept the patient's initial, vague statement as the definitive chief complaint without further probing. This fails to meet the regulatory requirement for a comprehensive patient assessment, potentially overlooking critical underlying issues. Ethically, it represents a failure to provide due diligence in patient care. Another incorrect approach is to focus exclusively on the patient's stated chief complaint and ignore other relevant historical elements like past medical history or medications. This is a regulatory failure as it deviates from the mandated scope of patient history taking. It is also an ethical failure because it can lead to a fragmented understanding of the patient's condition, potentially resulting in adverse drug interactions or exacerbation of pre-existing conditions. A third incorrect approach is to dismiss the patient's chief complaint as irrelevant due to the presence of other objective findings. While objective findings are vital, the patient's subjective experience of their chief complaint is a critical piece of the puzzle. Ignoring it is a regulatory and ethical lapse, as it disrespects the patient's perspective and can lead to a misdiagnosis by failing to consider the patient's primary concern. Professional reasoning. EMTs should approach patient history taking with a structured methodology. Begin with open-ended questions to understand the chief complaint in the patient's own words. Then, utilize a systematic approach like old carts to gather details about the chief complaint. Simultaneously, Gather essential collateral information such as past medical history, medications, allergies, and last oral intake. This comprehensive approach ensures that all pertinent data is collected, allowing for accurate assessment and effective treatment planning, thereby adhering to regulatory standards and ethical obligations to provide the highest quality of care. Question 17. The efficiency study reveals that different oxygen delivery systems have varying levels of effectiveness in patient care scenarios. Considering a patient presenting with moderate respiratory distress, audible wheezing, and a reported history of asthma exacerbation, which oxygen delivery system, when applied correctly with supplemental oxygen, would be the most appropriate initial intervention to improve oxygenation? Option A. Administer supplemental oxygen via a non-rebreather mask at 4 liters per minute. Option B. Utilize a bag valve mask with room air for spontaneous breathing. Option C. Administer supplemental oxygen via a nasal cannula at 2-6 liters per minute. Option D. Administer supplemental oxygen via a non-rebreather mask at 10-15 liters per minute. The correct answer is D. Administer supplemental oxygen via a non-rebreather mask at 10-15 liters per minute. Explanation. Scenario analysis. This scenario presents a common challenge for EMTs, rapidly assessing a patient's respiratory status and selecting the most appropriate oxygen delivery device to optimize oxygenation and ventilation while minimizing risks. The challenge lies in understanding the nuances of each device's capabilities and limitations in relation to the patient's clinical presentation, which can change quickly. Failure to select the correct device can lead to inadequate oxygenation, hyperventilation, or even barotrauma, directly impacting patient outcomes and potentially violating standards of care. Correct approach analysis. Administering supplemental oxygen via a non-rebreather mask at 10-15 liters per minute is the best professional practice in this situation. This device is designed to deliver a high concentration of oxygen, up to 90-95%, to patients who are breathing spontaneously but require significant oxygen support due to hypoxemia. The reservoir bag allows for the collection of exhaled air, which is then mixed with fresh oxygen, ensuring a high FiO2 is available for inhalation. This approach directly addresses the patient's likely need for increased oxygen delivery without the risk of delivering excessive tidal volumes or positive pressure ventilation, which is not indicated at this stage. This aligns with established protocols for managing respiratory distress and hypoxemia, emphasizing the principle of providing adequate oxygenation while avoiding unnecessary interventions. Incorrect approaches analysis. Using a nasal cannula at 2-6 liters per minute would be an incorrect approach. While a nasal cannula is suitable for patients with mild hypoxemia or those who cannot tolerate a mask, it delivers a lower concentration of oxygen, 24-44%, and its effectiveness is highly dependent on the patient's respiratory rate and tidal volume. For a patient exhibiting signs of moderate to severe respiratory distress, this device would likely be insufficient to meet their oxygen demands, leading to continued hypoxemia and potentially worsening their condition. This failure to provide adequate oxygenation constitutes a breach of the standard of care. Utilizing a bag valve mask, BVM, with room air for spontaneous breathing would also be an incorrect approach. A BVM is primarily used for patients who are apneic or severely hypoventilating and require positive pressure ventilation. While it can deliver high concentrations of oxygen when connected to an oxygen source, its use for a spontaneously breathing patient without signs of inadequate ventilation can lead to hyperventilation and subsequent respiratory alkalosis. Furthermore, using room air would negate the purpose of providing supplemental oxygen. This intervention is not indicated for the described patient and could cause harm. Administering oxygen via a non-rebreather mask at 4 liters per minute is also incorrect. While a non-rebreather mask is the correct device, the flow rate of 4 liters per minute is insufficient to maintain the reservoir bag's inflation and deliver the high oxygen concentrations the mask is capable of. This would result in the patient rebreathing a significant portion of their exhaled air, diluting the inspired oxygen concentration and rendering the device ineffective for treating significant hypoxemia. This represents a failure to properly utilize the equipment according to its design and intended purpose. Professional reasoning. EMTs should employ a systematic approach to oxygen therapy. First, assess the patient's airway, breathing, and circulation, ABCs. Evaluate the patient's respiratory rate, depth, effort, and oxygen saturation, if available. Based on this assessment, determine the level of oxygen support required. For patients with mild distress and adequate breathing, a nasal cannula may suffice. For patients with moderate to severe respiratory distress and signs of hypoxemia, a non-rebreather mask is indicated. For patients who are apneic or severely hypoventilating, a BVM with supplemental oxygen is necessary. Always ensure the chosen device is functioning correctly and delivering the appropriate flow rate to achieve the desired oxygen concentration. Continuous reassessment of the patient's response to oxygen therapy is crucial. Question 18. The assessment process reveals a conscious adult patient complaining of severe pain and inability to bear weight on their left leg following a fall. Upon examination, there is visible deformity, swelling, and ecchymosis around the midshaft of the femur. The patient reports hearing a snap at the time of the injury. Considering the EMT's scope of practice and established protocols for musculoskeletal trauma, which of the following actions best represents the appropriate initial management? Option A. Apply a traction splint to the injured leg, regardless of the visible deformity, to reduce muscle spasm and pain. Option B. Advise the patient to try walking on the leg to assess the extent of the injury before immobilizing. Option C. Immobilize the injured limb in the position found, ensuring that the splint extends above and below the suspected fracture site, and manage pain as per protocol. Option D. Attempt to straighten the deformed limb to align it with the unaffected leg before applying a splint. The correct answer is D. Attempt to straighten the deformed limb to align it with the unaffected leg before applying a splint. Explanation. The assessment process reveals a patient with a suspected fracture, presenting a common yet critical challenge for emergency medical technicians, EMT. The professional challenge lies in accurately identifying the nature and severity of the musculoskeletal injury, stabilizing the affected limb to prevent further harm, and initiating appropriate interventions while adhering to established protocols and scope of practice. Careful judgment is required to differentiate between simple strains, dislocations, and fractures, and to manage pain effectively without compromising patient safety. The correct approach represents best professional practice by prioritizing patient safety and adhering to the National Registry of Emergency Medical Technicians, NREM, standards for musculoskeletal injuries. This involves a systematic assessment, including history taking, physical examination, looking for deformity, swelling, bruising, pain, and loss of function, and appropriate immobilization techniques. Immobilization is crucial to reduce pain, prevent further damage to surrounding tissues, nerves, blood vessels, muscles, and minimize the risk of converting a closed fracture into an open one. This aligns with regulatory requirements to provide care within the EMT's certified skill set and to act in the patient's best interest, as outlined in the EMT National Standard Curriculum and relevant state EMS protocols. An incorrect approach that involves aggressive manipulation of the limb to set the bone is a significant regulatory and ethical failure. This action exceeds the EMT's scope of practice, which strictly prohibits such interventions. It violates the principle of do no harm by potentially causing further tissue damage, increasing pain, and exacerbating the injury. Furthermore, it disregards established protocols for fracture management, which emphasize immobilization and transport. Another incorrect approach, such as neglecting to immobilize the injured limb due to perceived minor pain, is also a failure. This overlooks the potential for unseen damage and the risk of displacement during transport, contravening the EMT's duty to provide comprehensive care and prevent complications. Finally, administering pain medication beyond the EMT's authorized scope, such as prescription opioids, represents a severe regulatory violation and an ethical breach, as it involves practicing medicine without a license and potentially endangering the patient through inappropriate drug administration. Professional reasoning in such situations should follow a decision-making framework that begins with scene safety and patient assessment. This includes a primary survey to identify life threats, followed by a secondary survey focusing on the musculoskeletal complaint. The EMT must then apply knowledge of anatomy and physiology to interpret findings, determine the most appropriate intervention within their scope of practice, e.g., splinting, traction splinting if indicated and trained, and communicate effectively with the patient and receiving medical facility. Adherence to local and national protocols, continuous assessment of the patient's condition, and documentation of all findings and interventions are paramount. Question 19. Compliance review shows a patient presenting with an altered level of consciousness and visible vomitus in their oropharynx, leading to audible gurgling sounds during respiration. Based on standard emergency medical technician certification guidelines, what is the most appropriate immediate action regarding airway management? Option A. Insert an oropharyngeal airway and then assess for the need for suctioning. Option B. Immediately suction the oropharynx using a rigid catheter to remove visible secretions. Option C. Position the patient on their side and encourage them to cough up the secretions. Option D. Administer oxygen via a non-rebreather mask and monitor the patient's breathing. The correct answer is B. Immediately suction the oropharynx using a rigid catheter to remove visible secretions. Explanation. Scenario analysis. This scenario presents a common but critical situation where an EMT must rapidly assess a patient's airway status and intervene appropriately. The challenge lies in recognizing the subtle signs of airway compromise, understanding the indications for suctioning, and executing the technique safely and effectively without causing further harm. The patient's altered mental status and potential for aspiration make this a high-stakes intervention requiring precise judgment. Correct approach analysis. The correct approach involves recognizing the need for suctioning based on the presence of secretions obstructing the airway, which is a direct indication for intervention according to standard EMT protocols and guidelines. The technique described, involving the use of a rigid catheter to remove visible secretions from the oropharynx, is the appropriate method for clearing a compromised airway in an unresponsive or semi-responsive patient. This aligns with the fundamental principle of maintaining a patent airway, a primary responsibility of an EMT, and adheres to established best practices for airway management. Incorrect approach is analysis. One incorrect approach involves delaying suctioning despite visible secretions and signs of airway obstruction. This failure to act promptly constitutes a breach of the EMT's duty to provide timely and appropriate care, potentially leading to hypoxia and further patient deterioration. It violates the core principle of airway management and the regulatory expectation for proactive intervention when indicated. Another incorrect approach is to attempt suctioning without adequate patient assessment, or when the airway is not clearly compromised by secretions. This could lead to unnecessary patient discomfort, gag reflex stimulation, and potential trauma to the airway tissues. It demonstrates a lack of clinical judgment and a failure to adhere to the principle of first, do no harm, which is a cornerstone of medical ethics and professional conduct. A further incorrect approach might involve using an inappropriate suctioning device or technique, such as using a soft catheter for thick secretions or suctioning too deeply into the trachea without specific indication. This can be ineffective, cause injury, or induce laryngospasm, all of which are contraindications for routine suctioning and represent a failure to follow established protocols and safe practice guidelines. Professional reasoning. EMTs should approach airway management with a systematic process. First, assess the airway for patency and the presence of obstructions. If secretions are visible and compromising the airway, especially in a patient with decreased level of consciousness, suctioning is indicated. The choice of catheter rigid for oropharynx, soft for nasopharynx if indicated and permitted by protocol, and the technique limited duration, appropriate depth, sterile technique are crucial. Continuous reassessment of the airway and the patient's respiratory status is paramount throughout the intervention. This decision-making process is guided by established protocols, training, and the overarching ethical responsibility to provide the best possible care. Question 20. The control framework reveals that an EMT responding to a call for a patient experiencing severe abdominal pain and vaginal bleeding must prioritize immediate interventions. Considering the anatomy of the female reproductive system, which of the following approaches best aligns with the EMT's role and responsibilities in this scenario? Option A. Focus solely on the abdominal pain, administer pain medication, and wait for further instructions from dispatch without assessing for bleeding or signs of shock. Option B. Attempt to visualize the source of vaginal bleeding internally to provide a more precise report to the receiving hospital. Option C. Immediately inquire about the patient's sexual history and menstrual cycle to determine the exact cause of bleeding before initiating any treatment. Option D. Assess for signs of shock, control any obvious external bleeding, and transport the patient rapidly to the nearest appropriate medical facility while maintaining patient privacy and providing reassurance. Correct answer is D. Assess for signs of shock, control any obvious external bleeding, and transport the patient rapidly to the nearest appropriate medical facility while maintaining patient privacy and providing reassurance. Explanation. The control framework reveals that emergency medical technicians, EMT, must possess a comprehensive understanding of human anatomy and physiology to provide effective patient care. When dealing with reproductive system emergencies, this knowledge is critical for accurate assessment, appropriate intervention, and patient communication. The challenge lies in the sensitive nature of these conditions, requiring both clinical expertise and a high degree of professionalism and discretion. The correct approach represents best professional practice because it prioritizes patient dignity and safety by focusing on the immediate life-threatening aspects of the presentation while respecting the patient's privacy and comfort. This aligns with the EMT's scope of practice, which mandates assessment and management of conditions that pose an immediate threat to life or limb, and ethical guidelines that emphasize patient confidentiality and respect. An incorrect approach that focuses solely on the reproductive organs without considering the broader clinical picture or patient distress fails to adhere to the principles of holistic patient care. This could lead to misdiagnosis or delayed treatment of underlying systemic issues. Another incorrect approach that involves unnecessary exposure or invasive questioning without clear medical indication violates patient privacy and consent principles, potentially causing further trauma and eroding trust. An approach that dismisses the patient's symptoms as non-emergent without a thorough assessment, based on assumptions about reproductive health, is a failure to meet the standard of care and could have severe consequences for the patient. Professional decision-making in such situations requires a systematic approach. First, assess for immediate life threats, e.g., severe bleeding, shock, signs of infection. Second, gather a focused history, being sensitive to the patient's discomfort and ensuring privacy. Third, perform a physical assessment relevant to the presenting complaint, again prioritizing patient dignity. Finally, communicate findings clearly and concisely to higher medical authority, advocating for the patient's needs.